This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome back to another episode of Impact Healthcare. And, the part of my job that I love is when my clients and colleagues turn into friends. And I've got somebody here who I've slept at his house and he slept at my house. It's great when people who do business together because they're aligned in a mission and a bigger cause. So I've got Braden Monaco here from Blue Horizon. Braden, for the audience here that doesn't know you and your great organization, give us an introduction.
Awesome. Thanks, Lester. Thanks for having me. And yes, we have spent a lot of time together. I think, as you mentioned, aligning personalities, aligning missions, aligning morals and all of that is certainly helpful in an industry that otherwise is very misaligned. So certainly helpful. So again, Braden Monaco, I'm one of the partners here at Blue Horizon Benefits. We are located just north of Boston. We are a boutique benefits agency focusing and helping our clients really navigate the complexities of healthcare, understanding ways they can decrease costs on healthcare, but also most importantly, improve the outcomes for their employees, who obviously, as we all know, are our number one assets. Without them, we all have nothing. So our number one mission every day is to really come to the table just caring and providing resources and tools to our clients to ensure that they're getting the best results they can from the money they're spending on healthcare.
So, Braden, when we were trying to think of where we were going to take this, right? We could talk about the Patriots and the Red Sox. We could talk about the weather. We could talk about it. But the one word, and I think you said, hey, one of the things I was noticing when I was thinking about this is I was driving around and there's so much innovation and progress happening. Talk to me about that, in your market in Boston. Like, talk about the innovation that is occurring.
Yeah, no, it's amazing. I mean, when we were, we booked this a few weeks ago now, and just kind of thinking through like what the challenges we have as advisors across the country, but obviously Boston, we're pretty stubborn to healthcare. Some of the best hospitals and providers in the country. People fly here from around the world to seek care. So there's obviously a stigma of finding the best of the best. But as I was kind of driving around, whether I was in the city, outside the city, there's a few things that come to mind. I just think of innovation in general is everywhere. I mean, from our cars and what our cars have become, to our smartphones, to I was at my daughter's orchestra recital last night, and I was just looking at the technology that's in this auditorium when these kids are performing compared to what it was 10 years ago. We do a lot in the construction and trade industry. One of the things I was thinking of is just drafting. They used to use drafting boards and draw things out, and now we have computer programs and technology that literally lay out every square inch of ductwork in wiring in a high rise, so we know nothing is bumping into each other, and we can plan these things ahead of time. I was thinking about the Seaport in downtown Boston, which is to me an innovative mecca in regards to like these buildings are on piers in the ocean, and we built a sub-city, right? So all these areas that otherwise weren't developed, we're finding ways to develop because we're innovating, and engineering is coming in to do things that seemingly people 15 years ago said wasn't possible. So I think that's where I kept going with this. It is hard. Like what we do every day, Lester, is very hard. What employers face in regards to cost and helping their employees is really hard. But if you don't continue to push the envelope with innovation and try to make change in some way, shape, or form, you're just going to be stuck, and you're not going to have high rises. You're not going to have schools with better technology. You're not going to have cars that drive themselves, right? So innovation is something that's all around us, and I think we have to find a way to embrace it in something as archaic as healthcare.
So, when we take that word and now drive it into healthcare, right? you and I met several years ago, and, even the conversation that I was trying to bring to you and said, hey, here's some things that are happening in other parts. It was, still kind of very sparse. Now you've fully embraced all of this. You've were a Broker of the Year finalist for Benefits Pro as a recognition of the things that you're doing. Yeah. Let's take and piece together some of the innovations that, again, you are looking outside of the state like a good advisor should and bring into the state. Let's talk about one and let's explain it and see where the conversation goes.
Yeah, no, you're absolutely right. I mean, I'd say 7, 8 years ago, I had this kind of aha moment that I realized I was like a Grim Reaper. I was the Grim Reaper 15 times a month with different clients, delivering renewals and saying, let's just choose the best, least worst option, right? So you're just stuck picking out of what's available. And I'm not saying that for every client that this is the solution. We truly believe that we're stewards of what our clients want and what they see their employees need. So we'll work with them in any fashion they need. But something that keeps coming up is frustration. We can't afford to keep getting these increases. We can't afford to pass this on to our employees. And then I got to a point, I'm like, well, the only options you have are to do that. So then I just started traveling like I hadn't done before and meeting folks like yourself and other innovators around the country and seeing all of the unique things from international sourcing of prescription drugs to direct contracting, just things as simple as the fact that there are tools to help an employee understand if the doctor they're going to at Mass General is actually good, right? Like, this isn't about completely and utterly blowing up the way you deliver healthcare. I think if you can just give employees access to tools to better understand where they're getting care. I've always utilized, like, I'm a firm believer in like understanding what you're buying, right? So like you look at like consumer reports. I mean, the consumer reports, everybody uses these in some way, shape, or form, whether they're buying a TV, a car, something. The one piece that we don't have is this, and I'm diatribe, just what I do well. My brother literally called me 2 days ago, and his son had to get a cast, and he got the bill for $900. And he said they kept charging me a copay when I was there, so I thought I was just paying. And then I get this bill afterwards. He's like, why don't they tell me what it's going to cost when I get there? And I literally started laughing. And like, it was an aha moment for me. Like, why would anyone understand this stuff? Like, other than, like, I don't understand fully when I get a bill, like what they did and how to read it all the time. So, and I've been doing this for almost, 15, 17 years, right? So like, I think that that's the piece of like advocacy, consumer support, and tools for them to make better decisions. And then I think it's like a funnel effect from there, right? So then all these other pieces that we can talk about and solutions can piece onto that, but it all starts with the consumer.
So let's go low hanging fruit. I think I'm gonna outline the conversation based on the things that you said. You brought up quality metrics. You brought up prescription drugs and international sourcing and manufacturer's assistance program. You brought up primary care and just being able to navigate. You brought up advocacy. So let's play in those pillars, if you will, and we'll jam for the next 15 minutes or so. Let's go low hanging fruit. Prescription drugs. So tends to be 20-25% of someone's total cost. It's a complete black box of an approach. And now you've got people like Mark Cuban coming into the business saying, oh my gosh, this was even more screwed up than I thought. Talk to us about that arena and what you've been able to do. And I guess I'm going to ask, how hard was it after you figured out that those things are there?
Yeah, I love change in general when I can see, feel, and touch it. I struggle when it's just opaque to me, right? Like I don't really understand how it's going to work. So there was a leap of faith that I took into this, and I just did it with the right people and understood. I mean, I did enough research and, learning and talking and seeing other people doing it. Then I'm like, okay, I mean, this is not always the way to look at life, but if enough people are doing it successfully, then it should work, right? If you look at that in other ways, it might not go well. But, again, it was to a point of, you see like this seemingly tangible item. Like in healthcare, so many things don't feel very tangible, right? You don't know, you go to the hospital, you don't know what's going to happen when you get put in the hospital. Prescription drugs is so simple to me. It's like it's manufactured, produced, it's labeled, it's delivered, and it's taken, right? Like these, it's just like, and it's the same thing for all of them. And you get to a point of saying, well, if I can buy the same exact car from a different dealership for a lower price, why wouldn't I do that? It's the same car, just a different sourcing capability, right? So I think that's where, to me, it was simple because it was tangible. Once we started doing it, it became even more simple, right? I mean, don't get me wrong, it does have moments of complexity and challenge, and I think that's what I do enjoy about it now, is that every day is a little different and we are helping people find solutions. So it was, you go into it with some faith and you go into it understanding that you're trying to do the right thing for people and for organizations and knowing that these things do work. But now that we've been doing them for a number of years, it's seemingly pretty simple, right? We understand that employee needs a medication. We look at multiple different criteria of that employee. What is their income? Where do they live? Obviously, what medication, their dosage, frequency, all these little things. And then you just try to find the best solutions, whether that's a manufacturer's assistance program, whether that's sourcing it internationally. In some cases, we found that employees' dependents are eligible for Medicare or Medicaid on their own, and that's a better solution, and that moves risk off of a company's health plan. An employee gets the prescription drug at no cost, and the employee's son got healthcare at no cost, right? So I think you can't look at it as just like a renewal and premium and a plan design. You've got to look at each case individually. But to your point on prescription drugs, like some come internationally, some we get manufacturer assistance programs, some we simply say you're filling it at CVS and you should drive a half a mile down the street to Rite Aid and it'll cost you $12 versus $200, right? And that seems so crazy to the average consumer because how's that even possible? But it is, because there's rebates and it's touching a lot of hands, and there's a lot of spread pricing in regards to what the manufacturer would charge and what the pharmacy is charging you. So there's a lot of pieces, but if you have the right partners in place, I guess where I was going with all of this, that the right pieces in place do their job, as Bill Belichick would say here in Boston, do your job. And if everyone does their job, things do fall in place pretty nicely.
So Braden, how big of a deal can this be? So, somebody might hear 12 to 200 and be like, all right, that's nice, but it's not like earth shattering. You've had some scenarios on some pretty big drugs that were big deals. Talk about an example of one.
Yeah, I mean, I look at this twofold. I look at this from an employer perspective, but also from an employee perspective. So while the 12 to 200 or vice versa doesn't seem that large, to an employee, that saves $2,000 a year. That's huge. That's a family vacation. That's rent. That's food. That's something, right? So like, I think, and then you add a lot of those little pieces up and then it becomes a much bigger outcome. But from an employer perspective, and in fact, the employee, you see, things like an Enbrel, Humira is becoming a little bit different now because there are some biosimilars and things of that nature coming out. But you look at Stelara and some of these medications that you're seeing a 30, 40, 50% in some cases discount by just sourcing them differently. So you can go from $170,000 a year medication to $110,000 or $90,000 depending. And we've got one that we sourced through a manufacturer assistance program that was a $720,000 a year medication that was sourced through, again, a manufacturer assistance program, no cost to the member, and it saved the plan $720,000. So you hope you don't want to come across those. As great of a success story as it is, it could have gone the other way and it could be challenging. But moral of the story, just as long as you have levers to pull and solutions available, then these things can be possible to save significantly.
So to make sure that the audience understands that type of solution only happens because of the structure that you created for that client. So it's not like you went to the same cast of characters you were going to before, and then all of a sudden that these programs magically grew out of the ground. This is hey, you created a structure that allows for this. And then you, as an advisor, and the team of people that you surround yourself with are digging through the data to then be able to catch these opportunities.
Yeah, no, I mean, I think the piece that jumps out when you say that is like proactivity, right? Like at the end of the day, none of this is reactive. I mean, there's moments where you have to be reactive to a situation, but the levers you put in place and the designs and the mechanisms you built for the plan are proactive, right? To your point of, not every organization, most at this point around here aren't open to innovation of this nature. But the ones that are, their eyes have been opened and they're seeing a different way. And, at the end of the day, yeah, we've fundamentally built the health plan differently. We're providing tools and resources to employees where we're outside of the normal carriers that most might associate with healthcare. But we're doing it in a way that's, again, very, very planned and very engaging with the member. But more importantly, the employer understands every piece. Like this isn't like, we go in as advisors and say, okay, here's what we're going to do. A lot of these this takes time, and people, we need to understand what's going on, how it works, understand the pieces of it. But once they do, they start to see they have control. And that's the part that I think most employers that aren't looking at this are missing out on, is the fact they actually can have some control of the outcomes versus just sitting back and being frustrated with what's coming.
What we call healthcare's biggest lie, right? That you can't do anything to control the cost of healthcare, and in fact, you actually can. So that's a jump off point, and that word proactivity, and what I would probably combine with advocacy, like, helping people kind of understand this better. And a lot of times that starts, with primary care and upfront. You were actually a big part of launching a new program up there. Talk about it and kind of the rationale of changing the way people are looking at it, starting at the ground where people access healthcare.
Yeah, no, we about 4 years ago now, I was approached by a local primary care doctor, very successful here in Massachusetts, Dr. Mark Alara. He is, like many other primary care physicians, frustrated with just the way the system's going, right? Like how they're being reimbursed, having to see a patient every 7 minutes to hit their metrics for financial viability. Understanding that he couldn't just spend time with patients the way he needs to provide them with the outcomes and the solutions they need to live a healthy life. So he kind of went on a quest and brought some of us along with him in regards to trying to deliver a solution to employers that really seemingly can solve some of these problems. Obviously, there's always going to be challenges as these things evolve, but the goal of the program is to lead with primary care, which I think is something that the world is missing. Obviously, we know that over 80% of downstream costs can be alleviated by just proactive primary care. So that's what he set out to do, and I truly believe in it. I think that if you have a good primary care doctor that you can have a regular conversation with, that's what everyone needs that, right? It's there's no reason why you should have questions about what's going on with your health or where to go or who to go to, or be worried about the cost of seeing that. So the plan, simple things in the plan, built with no cost primary care, no matter what. So anytime you or someone in your family sees primary care, there's no cost, right? So obviously there's other bells and whistles throughout in regards to advocacy, and that was one of the pieces that we brought in. More importantly, like you got the primary care doctor who is there as your resource, but you also have an advocacy tool that's available to just really help guide your care, just ask questions, help with billing and claims issues, just alleviate a lot of the pressure. I always use the example, like if you're in a new city, I'm flying into a new city and I'm landed at the hotel and I have no idea what's around me or what to do. I go to the concierge desk and I say, can you help me find a good steakhouse? Or we're looking for, we're in Boston, I want the best lobster roll you have, right? And they'll help you, guide you, and you take their advice and you move on or whatever. But at least you have the tools and the resources to make those decisions. So yeah, Dr. Alara, I think he's an innovator. I think he is trying to do here in Boston what is working very well in other parts of the country. I think we have an uphill battle here in Boston in general, just because of the way, the consolidation in the healthcare industry is in general. But it's working, and we're saving employers significantly. And he's doing some good work to bring primary care back to the forefront.
I want to talk specifically about some of the results, but I don't want to miss out. So, that advocacy and the fact that the primary care is free, you're removing the barriers of accessing healthcare, right? Which is the annoyance. Hey, this is hard. If I'm a diabetic, I got to go see the doc a bunch of times over the course of the year. Like, now this is fostering a platform for removing those barriers that then make it more likely for someone to be healthier, right? So I always joke that the cheapest heart attack is the one you never paid for, right? And so you looked at, but there's also downstream. So talk about some of those successes of, like, I don't know, let's use, I blew out my knee. In this example, when I blow out my knee and I have a choice, that advocate's helping me steer that. But talk about the financial benefit and the quality benefit of that advocacy doing that steerage and what it means for employees and the employer.
Yeah, no, it's great. I mean, I go back to the idea of consumer reports, right? Like all the information's available in regards to outcomes, readmittance rates, price of procedures based on a doctor and a facility. All this information's available. The question is, how do you get it? And as of right now, I mean, if I could figure it out, I think the best tool would be an Orbitz for healthcare, right? Someone, as a consumer, it's free for me. I can log in, just type in what I need, my insurance, and it tells me how much it is, right? Providers and hospitals and health plans are supposed to be transparent, and they are in regards to their files and readable files and all that fun stuff, but no one can read them, right? The data's there. So there are aggregators, organizations that are doing this, and these advocacy tools are able to use that data to, again, drive patients and members to higher quality facilities, lower cost facilities, facilities with better outcomes. So like I use, in Boston, simple terms are, you look at within Boston, within a walking distance, you've got, dozens of hospitals, and you're just trying to wrap your head around, Mass General is the hospital, right? Like, yeah, if you're having open heart surgery, it might be the only place you want to go. I don't know that for, but when you're these services that are, like you said, knee replacements, shoulders, even, heart surgery or stents and things of that nature, if you're just taking the advice of your doctor, which seemingly is the right thing to do, but they don't know the outcomes and the quality and the costs associated with the folks that they're referring you to. So they're only referring you there, one, because either there's an affiliation, two, because it's their friend, or three, just because it's always the way they've done it and it seems to have worked, right? So these advocacy tools, the best part to me is that they're going to give you options. They're not going to traditionally say, you have to go here, which is, I think, a lot of organizations' fears when I say steerage or concierge or navigator. It's the idea of, hey, Lester, I see you have to have a total knee replacement. I see that you live in Danvers, Massachusetts. Here are 5 facilities within 25 miles or 3 facilities within 25 miles that we have highlighted as high quality, low cost facilities that we can steer you to. And if you use one of these facilities, there'll be absolutely no cost to you out of pocket. If you choose to use Mass General, that's up to you, but you will have your out of pocket costs, and we don't know, the outcomes or whatnot. We're not advising to that. So for me, it really is just like information at your fingertips across the board. But for me, making sure the low hanging fruit of MRIs, PET scans, CAT scans, labs, all those things are, certainly steered to lower cost facilities. Most folks just kind of are robots, myself included. You're in the hospital, there's your doctor, you go to the lab, get your lab work done, but you don't realize you just paid 5 times as much as you would have at a LabCorp. So I think for me, it really just comes down to that idea of, like, same as a hotel, having someone that can just be your eyes and ears into your healthcare journey. Obviously, you can run it by your doctor and you can get, the feedback from them as well. But that's where you start to see this cost thing shift, is when you start having people make educated decisions along the way.
And, in that scenario, let's move into, okay, we've nibbled around these things create value on both sides. Let's dive into a case study. I know you've got several, but let's start with one, that's had, a drug removed and the surgeries moved from point A to point B and images moved. What kind of savings? Like what's that look like?
Yeah, I mean, the prescription drug one, we talked about that. I mean, that I don't think I have a group right now utilizing these strategies that hasn't had a prescription drug sourced, whether it's through manufacturer assistance program or internationally, that hasn't saved 30 to 40% of that prescription, anywhere from, $40,000 or $50,000 a year in savings, again, up to $720,000 a year in savings. If I were to pick, in regards to like daily services, I mean, Boston's tough, right? So a lot of employees, again, are stubborn to healthcare. So our goal is just to give them information to make these decisions, and they're choosing from there. I hope one day we have better direct contracts and we really have things in place with centers of excellence that we can say this is where you have to go and this is where the outcomes are. But most of the things are around, MRIs, around blood work, around a knee surgery, steerage. Actually, it was a shoulder. I lied. A shoulder surgery steerage to New England Baptist. Originally was going to be at Brigham and Women's, I believe. Just the steerage alone was almost a $40,000 swing, right?
So when you aggregate these things together, I remember seeing a LinkedIn post and you were holding a big check, with a rebate. Talk about something like that, so like people can get the tangible.
Yes, I love it.
30 here, 10 here, 15 here, 18 there. What's that look like on a annual budget basis?
Yeah, I mean, there's one organization that we delivered almost a $60,000 refund check to, a surplus check, and that's because their employees made the right choices along the way. Obviously, outcomes are based on employee engagement. We can do everything well on our end, but if employees aren't engaging, then it just doesn't surmount to what you expect. Another entity right now where that organization had about 65 or so on the medical plan. We have one about 85 or 90 on the medical plan. They're projected to almost have $150,000 surplus this year. In regards to that, and I guess what does the surplus mean? We estimated with the underwriters and stop loss that their costs are going to be X, and they're coming in $150,000 or so less than that, and that is pure money back to their bottom line.
So I want to dig into that because you're used to this now. So you're saying it like it's no big deal. So $60,000, roughly 60 people on the plan. That's $1,000 per employee per year back in the employer's pocket. So, and I happen to know that group. That's a nonprofit group, if I'm not mistaken, correct?
Yep.
So that's enormous.
Yep.
On what was probably a $600,000-$700,000 overall budget. Now we're talking about they were 10% below where they budgeted. In the normal world, that would have been extra profit for the insurance company. In this world, you delivered a really big check, both in size and amount, to a nonprofit who's doing amazing things for the community at a number that was $1,000 per employee per year. Plus, their employees had an advocate, so somebody to help them through this maze that we call healthcare and health insurance.
Yeah.
Had free healthcare when they engaged, and did that steerage, got free drugs when they were able to get free drugs on them. So better benefits, lower cost for the member, employer puts an extra $1,000 per employee per year back in their pocket to be able to do more things for the community.
Yeah, it's amazing. Yeah, you nailed it. You nailed it.
Like that's a Hollywood story, right? I mean, that like literally, like healthcare is boring, and most people And then the other one, 80, 85 lives, 150. Now we're talking almost $2,000 per employee per year. What kind of industry was that group?
Medical professionals. Yeah.
Okay. So again, I mean, and quite honestly, medical professionals a lot of times are the biggest pain in the rears as clients because, the what do they say? The person, yeah, whatever. I don't know that expression, but I want to end with something that as entrepreneurs we hold near and dear to our hearts, which is working with and appreciating the struggle, like how hard the journey is. You actually build that into your business, and you go after a certain type of clientele, construction, blue collar, name on the door, talk about that, because I think, again, it aligns with a mission, but it aligns into somebody's business and how they even approach their business. And let's end with that.
Yeah, no, I think that one of the things I've learned over, my career, and it's kind of been a light bulb moment over the last 5 or 7 years, is I do love the construction industry. I think that there is something to be said about folks, and it doesn't have to be the construction industry. I've just found a niche there, but working with folks that it's blood, sweat, and tear money, right? Like these are family businesses, legacy, generational organizations. Every dollar matters, whether it matters to the owner's bottom line to continue their legacy and pass their business on to their children, whether it means being able to provide, I think one of the things that I've seen in the construction industry over the last 10 years is a major shift in work-life balance, work quality, what construction companies are offering to their employees from compared to, the biotechs of the world or the technology firms. They're being able to reinvest back in their organizations. Construction companies traditionally have a pretty low margin, profit margin. So when you can sit back and say, we can either save you money or, even when you go back and say you got a 10% increase, they're thinking like, well, I got a 10% margin. So to cover that, I've got to do what? Wait a second. How much more profit do I have to do? What more revenue do I have to bring in? So, but we've just found that our construction companies work well in this model for a couple of reasons. One major reason for me is that construction companies in general, whether it's general contractors, subcontractors, all of the like, are very conscientious of safety. Workers' comp, obviously, you have a car accident, you have a slip and fall, you have someone that didn't wear their hard hat, someone with steel-toe boots weren't on, didn't have the reflective vest, an accident happened. There's significant costs associated with that. Construction companies are very mindful. They have weekly toolbox talks. They have safety meetings. They've got all these things in place to decrease the frequency and severity of those claims. So when I come in and talk about healthcare and trying to find the levers you can pull to decrease the frequency and severity of claims, it makes a lot of sense. A lot of construction companies have understood using captives as a solution for their workers' comp. So having the conversation, while seemingly the same, there's a lot of differences, but they understand the concept. So it's been an open dialogue, and a lot of organizations in the construction industry have been much more open to understanding these solutions. And again, for me, it's selfish, I guess, but I really love working with someone that's names on the door because I truly believe that in our model, we care a lot and we work hand in hand in a partnership approach with our clients. So when I'm working directly with an owner or directly with his leadership team or her leadership team, we really get great results.
Love it. Love it. And it makes sense, right? We do things on the safety side and the workers' comp side to mitigate risk. Mitigate risk is either, hey, how can we prevent a claim from ever happening? Or if we do, how can we limit, right, the number, frequency, and the amount, severity? Well, making free primary care available for somebody is, trying to make sure that diabetic does the things that they need to do in order for it not to be a catastrophic claim in 3 or 4 years. So that is risk mitigation. Hey, how are we limiting even the claim from ever happening? Again, back to a diabetic who's controlled is, $2,000, uncontrolled is like $70,000. So that makes sense. Getting somebody to get a $400 MRI versus a $4,000 MRI, that is loss control. We got to pay a claim. We're not trying to not pay the claim. We're just trying to say, hey, you could pay less. So it makes complete sense, and I love it. So, Braden, if someone, out there is listening to this and is like, hey, I want to learn more from this guy, where does somebody find Braden and more about BHB?
Of course. It's easy, BlueHorizonBenefits.com or Braden at BlueHorizonBenefits.com. LinkedIn, find me on any social media. If you want to see my family life, find me on Instagram. I don't care how you find me. Just find me. I'm here to help. I'm always a resource. One of the things I truly pride myself in is being someone that people can just reach out to, no obligation, just to help answer questions or learn. If we can keep educating people, the more people we educate, the more impact we have. Everybody will do well. So it's not about the money. It's about helping people.
Agreed. And I love that you are fighting a fight in a market that is slow to fight that fight. But, if you're out there and you're in Boston, it's absolutely possible. The things you read from other places is absolutely possible. Yeah. Call Braden. Braden, thanks so much for being a guest. Thanks for the fight that you do and advocating for your clients and their employees.
Back at you, my friend. If it wasn't for you and other folks around the country, we probably wouldn't be fighting this fight. So I appreciate it.
Rising tide lifts.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.